I'm back with Dr. Michael Rowe from the Rockford Spine Center, and in this segment we're going to be talking about the number of people in the U.S. that suffer from back pain. You know, a recent study showed that nearly 22 million Americans suffer from back pain on a daily basis, and a place in Rockford especially that, you know, deals with a lot of these patients is the Spine Center. Can you tell me a little bit about the usual patient that you guys get and what your protocol is to deal with their pain?
Sure. Well, as you said, back pain is immensely common, but the vast majority of it actually gets better within a week or less. And so for back pain or neck pain that comes on suddenly, patient's regular physician is more than capable of handling that. Someone like me or people at the Spine Center, we usually get involved when people have been having this for some time and it's been getting worse to the point where they're really debilitated and it starts to go down their leg or down their arm. In those cases, the pain going down the leg, what's commonly referred to as sciatica, or the pain going down the arm, this is from pinched nerves, and that pain is incredibly intense. This actually, people say that if you have that pain, it makes the back pain you started with look like nothing. Furthermore, that pain, it prevents you from walking. And when you cannot walk, your quality of life really goes down the tubes.
Oh, for sure.
So that's why people come to us and then we start to treat.
And now, what are a lot of these pains caused by? Is it a lot of them come from work-related accidents or athletes I'm sure you deal a lot with?
Right. Well, you know, it's funny. I think that there's a changing pattern. There was a time when the workplace was rather dangerous, but due to enhancements in work ergonomics and environment, a lot of moves made by many employers to try and decrease the number of workplace injuries. Now, speaking to a lot of doctors who cover those occupational medicine situations, they say the injuries are actually pretty rare. The latest research shows that why some people get back or neck problems and some people don't probably has a lot to do with genetics. And that kind of makes sense because, you know, why would one otherwise healthy 30-something person have a disc problem and the other one not? I mean, it's really not to do with work or body weight or smoking. The best research shows that it's probably a genetic component, age-related issues, and then luck.
And now, if you have to end up doing surgery, how do you go about doing that? How do you, I guess, diagnose it and then afterwards follow up with your patient?
Sure. Well, I would say 9 times out of 10, just talking to the patient and examining them, that'll tell you what's going on. X-rays and MRI will usually confirm the diagnosis, and then we offer options. Often patients just need to be told this will get better on its own. Sometimes physical therapy or some cortisone injections in the neck or back will speed things along, keep people comfortable while the body heals. It is only the patients that do not get better after these other things have been tried that require surgery. And in 2012, the way we do spine surgery is radically different than the way we used to do it even 10, 20 years ago. The incisions we use now are so small in many cases. Many of the discectomy surgeries I do, the incision is half an inch long. That's smaller than your pinky finger. That's what I tell patients. So these are outpatient surgeries. Patients go home same day, and I usually tell them you'll be fully recovered from the surgery in 7 days and back to work, no restrictions. Now, patients will often say, well, I don't know if I'm ready to go back to work in 7 days. I need more time. We'll do some physical therapy, get you recovered from the weeks of debilitating pain leading up to the surgery. And then they go.
And now spine, people think spine surgery, and it's scary, it's like a shock. Oh my gosh, what am I going to do? How do you, how do you calm people and tell them, you're in good hands here, and tell them that they're going to be better off after the surgery, possibly, if that's what they need?
Right. Well, like I said earlier, we do not offer surgery unless there's really an excellent chance that they'll get better. But the way that I personally present it is I present them options. You do always have the option of just living with the problem. But the thing is that if you've not gotten better with the other treatments, such as physical therapy or epidural injections, then it comes down to a choice. You can either live with it, or you can accept the small risks that go with surgery. And once those risks are explained, and once the odds of success are explained as well, most patients will choose to take their chances with surgery rather than just live with the pain. And I'd say the vast majority of our patients are incredibly happy. And the most common thing that they say is, I wish I had done it sooner.
For more information on the Rockford Spine Center, you can visit their website, rockfordspine.com. And for more tips on avoiding cell phone spamming, go to Cub's website at citizensutilityboard.org. That wraps up another segment of 13 Cares. Join us next weekend and have a